Hello everyone, welcome to CCI's webinar on CNOR Certification Pathway to Excellence. Thank you so much for carving some time out of your busy evening to join me for an hour of information and hopefully great information on helping you prepare for this next stage of your professional journey. Couple of housekeeping things. If you have any questions, I'll be answering them throughout the webinar and then again at the end, and I will stay on as long as necessary to answer your questions. You can submit them through the chat feature, which is at the lower right-hand corner of your computer screen. And if you need additional support, please send us an email. That's the preferred mode of communication right now. We're all working remotely here at CCI in Denver, and we're able to respond most quickly if you send us an email to that info@cc-institute.org address. I need to provide this disclaimer for you. My job tonight is not to sell you anything, but I will be talking about some products that CCI sells, and I need to make it very clear that you do not need to purchase anything from us. And the more things that you buy doesn't increase necessarily your chances for success on the exam. So please, I know that this is an expensive endeavor. I'd like you to spend your money wisely on things that will have meaning for you as you prepare. My name is Julie Maurer. I'm the nurse manager for education development here at CCI, and this is probably one of the most enjoyable parts of my job, is to talk with people who are interested about certification. So I'm looking forward to this evening. Here are our objectives for tonight. We're going to look at eligibility requirements, which is one of the more frequent questions that we get. We're going to look at what is actually on the exam. We're going to look at some study strategies that will hopefully not only save you some time, but help you be successful on the exam, because that's obviously all of our goal. We're going to look at how to answer multiple choice questions, and we're going to look at the application process. So we've got a lot to cover tonight, so let's get started. Certification is defined as the documented validation of the professional achievement of identified standards of practice. In this case, we're talking about perioperative nurses. I think that all of us like to think that we do a good job every day, but it's difficult to convey that level of expertise without some sort of widely recognized validation, and certification is one of those. So this is a great way to not only demonstrate that you have gone the extra mile in preparing to take care of your patients, but that you're also committed to staying up to date on the most current practice. And we all know, especially in this last year, how quickly things have changed. And certification, even though I know you are all focused on the exam, and that's the way you should be, this is only the beginning step. And this is really a lifelong commitment to this part of your professional journey, is making sure that you are keeping up with trends, best practices, standards, guidelines, then you can apply to caring for your patients. Let's look at what it takes to be eligible. You need to be licensed as an RN. Can't have any disciplinary action or restrictions on your license. The CNOR is an internationally recognized credential. So I may have people on the call who are in Australia or Saudi Arabia or South Africa. Wherever you're working, wherever you're practicing, you need to have that unencumbered license. You need to have completed a minimum of 2 years and 2,400 hours of perioperative nursing practice. And there are 4 major buckets that we use to describe what that would look like. The first one is direct patient care. And certainly someone with 2 years of experience is probably still in that role. But as we progress in our careers, we tend to branch out and become managers or educators or go into research. If you are not sure about your eligibility, please, please, please send us an email. If our outstanding credentialing specialists can't answer the question, they refer them to me. Some of us are in non-traditional roles. We may be in IT, we may be doing CMS surveys, we may be a director of nursing. And am I eligible? The answer to that is that if you can say that half of your time is spent somehow impacting the patient during their intraoperative experience, then yes, you are eligible. Let's look at a couple of those roles. Let's look at a director or a CNO or a manager. And they are no longer providing direct patient care, but they are hiring people, they are developing policies, they are purchasing equipment that care for the patient during that intraoperative phase of their perioperative experience. So yes, they're eligible. The other one that may not be so obvious is IT, and you are responsible for helping to make sure that your electronic health record system is working properly. Certainly, those records pertain to the care and documentation of care of the patients during their perioperative experience and in the OR. So yes, if you're working for IT and you're orienting people on how to use the electronic health platform, you're designing the programs that support documentation, absolutely, you're eligible. And you need to be working either full or part-time in a perioperative nursing role. Now, obviously, the more you're working, the quicker you can get that 2,400 hours in 2 years, but we do not define what part-time needs to be. If you're given lunch reliefs once a month or taking call one night a week, whatever that may be, as long as we could call your supervisor and say, does Julie work for you in the perioperative department? And they would say yes, then yes, you are eligible to sit for the exam. The CNOR exam is compiled of 200 multiple choice questions. Of those, 185 are scored and 15 are basically practice questions. The only way we can really tell how a how a question is going to perform is to give the exam and test it. So 15 of those questions, and you will never be able to tell which ones are those practice trial questions, are not scored and they do not reflect on your total score at the end. If you get them right, it doesn't count. If you get them wrong, it doesn't count. So there's 185 scored questions. We update the exam annually, and it's not just the exam, it's all of our test preparation materials. As soon as the guidelines comes out, we're sitting down and making sure that things haven't changed. I go through all the major references, and we'll talk about those in a minute, and update them down to the page number for things like our study plan and our study guide to make sure that the information is accurate and also that it makes it a little bit easier for you to access. We have a testing partner who actually administers the exam. That's not CCI. In this case, it's Prometric. They have offices all over the country, all over the world actually, where you would go and take your test on a computer. And we'll talk a little bit more about testing a little bit farther down the line. And you may take your exam Monday through Saturday, excluding holidays. And again, those test centers are all over the country. Let's look at some resources. This is what is on the exam. Now, I'm not giving you guys any double secret information. Everything I talk about tonight is on the website, including the information on this slide. We just finished a job analysis. We're required to do that about every 5 years by our accreditation bodies. And what we do is we take people who are CNOR certified, actively practicing in the field. They sit down in a big room and look at these big buckets and go, yep, this is what a perioperative nurse is expected to know and do, and how much of their time is spent in each of these big buckets. So if you look at this, these new subject areas, this is pretty new. This just came out this year. And the buckets look a little bit different. We've rearranged the content a little bit and changed the percentage of questions a little bit. So that's one of the reasons why it's really important to get the most up-to-date information on exam content, and then using the most up-to-date references to align with this content. And that puts you in the best place to be successful. You can use this information in a couple of different ways. Some people just start with subject area 1 and go through in order. Some people pick the areas that they are least familiar with, and some of them look at the percentage of questions, which is in the right-hand column, and say, you know what? Inter-op is the heavy hitter here, so that's where I'm going to spend the majority of my time. So you can use this information in a variety of ways as you design your study plan. There are 3 major books that we use to write questions from. So it makes sense that you use these same books to study. The first one is the current edition of AORN's Guidelines for Perioperative Practice. Every January, a new guidelines comes out, and what they do is update about 25% of that book every year. One of the most common questions that I get is, I have an older version. Is that okay? Well, I always recommend that you get the most current version, and I understand that the cost is a factor here, and I'm going to show you a couple ways to save a little bit of money. But if you are studying outdated information that's no longer valid or accurate or true, and you get to that section on the test, that could jeopardize your chances of being successful in answering those types of questions. The other thing is that it's going to skew the page numbers for your references a little bit. I just went through this afternoon. There's a new Berry & Cones that just came out. You'll see that 2021 14th edition, brand new, just got it about a month ago. I had to go back in and change my page numbers for my references in this webinar, and they were off between 1 and 4 pages, which is not a lot. I mean, it's the same chapter, but if you're trying to save some time and get right to that section on the page, you'll have to do a little bit more detective work to get to that information if you're using an older version where the page numbers don't sync. So we've got the guidelines. This is sold through AORN. The other 2 references, and you do not need both of them, one or the other is fine, is Jane Rothrock's Alexander's Care of the Patient in Surgery, or Berry & Cones Operating Room Technique. Now, both of those books have been around for a long time, probably 40 years. So you can find pretty old copies of these. Please, please, please. Again, this information changes. Berry & Cones has some nice new additions in their newest version. So that's why they update, is because things change. So I really recommend that you get those newer versions. A couple ways to save you money. AORN sells both of these. It's probably cheaper to go to Amazon. And certainly with Alexander's, which has been out for a little while, you could probably get a good used copy of that 2019 version. Probably you can't do that with Phillips because it just came out. But you can also rent these books for 3 months, which is what we recommend you study for anyway, or you can buy the book and then sell it back when you're done. And you get maybe 30% of your money back. You don't get it all back. But again, these are some ways that you can save some money. If there are several of you studying, you may all want to, chip in 30 or 40 bucks and get your own books and share them. You might want to check around your department, see if anyone has just taken the exam, or if they're taking an RNFA program where they have to have Alexander's in the guidelines. See if they'll share. Even if your department will not pay for certification, and I hear this a lot, and some people view this as a barrier, see if they won't at least purchase these books and have them in the department for everyone to use. This isn't just for certified folks. This is how everyone should be guiding their practice with the information in these books. If you're in a hospital that has a library, they probably have these books. So it can be a challenge a little bit, but there really shouldn't be a barrier to somehow getting at least one of these books to use for studying. Now, if you're a book junkie like me, there are a lot of other resources that you may want to look at. A lot of our patients come to us because of the disease process that is requiring them to have some kind of surgical or interventional procedure. So a good pathophysiology textbook that helps you understand not only those types of surgical implications, but also, are they diabetic? Do they have hypertension? Do they have heart disease? A lot of our patients come to us with a lot of conditions that aren't directly linked to the surgical procedure, but they have a huge impact on how we plan their care. Medical dictionary, TABRS is still the gold standard. If you work in a hospital, they should have this on your med-surg or ICU floors if you don't have it in your department. There are a lot of different lab manuals. Your pathology department should have one that hopefully they would let you borrow to look at. A lot of places have a hospital formulary on their intranet, but I'm going to give you a tip. This ACCRUAL, you can download the app and put it on your phone. It's free, and you can look up. I have never been able to not find a drug on this formulary, and they update it all the time so that you're not worried about things being pulled or a new drug not being on there. So I love ACCRUAL. I use it all the time. If you're a member of AORN, you know that you get the journal every month. If you're not a member, see if you can't borrow journals from one of your friends who is a member. And I certainly endorse us supporting our especially nursing organization. I've had people tell me this is why I passed the exam, is I read the journal, I did the little quizzes at the back of the major articles. It helped keep me up to date. It provided little analyses and synopses and summaries of the guidelines. It's a great resource. AAMI standards should be in your SPD department. And then certainly on the website, Joint Commission has some information. CDC, World Health Organization, both of those have a lot of information that's free. Anything with .gov after it, it's available to the public. Both of our partners, anesthesia and surgeons, have very nice websites with information that's certainly applicable to anyone who's working in the perioperative setting. So this is gives you permission to look beyond your everyday role and learn more about perioperative nursing. And that's really the point of certification, is not to just validate what you know right now, but to have you stretch a little bit. We have some free resources, and all these are at this, this URL. We have our handbook, and I really recommend that people go through this. A lot of people don't even know that it's there, but besides that table that I showed you with the 9, or now it's 7, see, you're catching me here, on the 7 subject areas, it also has the task and knowledge statements, which is actually an outline under each of those subject areas. So when people start studying, I think sometimes they don't know what they're studying for or studying about. But if you would go to the task and knowledge statements, it will be very specific on here's what's covered on the exam. The study plan, I take those 3 books we just got through talking about, the guidelines, Alexander's, and Berry and Cohn's, and then I've taken the key words from each of those subject areas and crosswalk that information, and it's down to sometimes the page where that information is found in those 3 books. It saves you time, it helps you get organized, and those are the 2 things that I hope I can help you with the most tonight. There are a few CNOR exam questions on our website. Please be aware that none of the questions either that I give you tonight that are on our practice exams, in our study guide, on our website, you will never find any of those on the actual test. Our CCI staff, we have amazing people who answer the phones, and I think they can answer about 98.5% of the questions that they get, that you guys give them. The ones that are, you know, the trickier ones, I work in a different setting, am I eligible? Things like that, they'll send on to me. And then these webinars, and we're recording this tonight. You're welcome to come back and listen to it again, or if you've got people that you know are planning to test, please let them know that this is a resource for them. Here are our prep materials. This is going to get launched, I believe, next week, the middle of September, our brand new exam prep guide is coming out, and we've updated it and we've aligned it with those new subject areas from the new job analysis. We've put some new questions in there. So if you haven't purchased it yet, you might want to wait until that new one hits the stores. We have an on-demand prep course that mirrors pretty much as it can the actual testing experience for the exam. I'm sorry, the online practice exam does that. The on-demand prep course, Dawn and I, Dawn is our Director of Education, have provided information to you in an auditory mode where we talk about the main areas of the exam and kind of go through the key points. So these are all resources for you. Again, purchase as you feel they would help you. Don't feel like you have to buy all of them. You may not want to buy any of them. But one of the things that CCI really prides themselves on is making sure that the information we have is the most current out there. Okay, let's look at some test taking strategies. I know that you are all busy, so I'm going to try to find some ways to save you some time. Do a self-assessment. Look at what you already do, what you already do well. Look at those areas, look at those task and knowledge statements and go, you know what? We don't do peds, we don't do hearts, we don't do eyes. Okay, those are areas I know I need to study more. But really start with what you know, do a little bit of a self-assessment. Use those subject areas in that table to help you get organized. It's just like if you're doing a big case with a new doctor. You don't wait until 7:28 that morning to start getting organized. You're doing things maybe a week before, but certainly the night before, making sure you've got all your equipment, that you know how to work things, that things are going to be sterile and available, that you have the positioning devices in the room. Yeah, you've done your homework, and taking this exam is no different. You do your homework, you're prepared, and that is going to alleviate a lot of the anxiety that some of you may be experiencing right now. You're anxious because you don't feel prepared, and taking the time to prepare is going to help a lot with that anxiety. We recommend it take 3 months to study. Now, this is very individual. Some people take longer, some people take less, but that is up to you. When you study. A lot of us think that we can multitask, but none of us can do several things as well as we can do one thing at a time. So this is really your time. If you need to go to work half an hour early so that you have a quiet place to study, if you need to have somebody watch the kids a couple hours in the evening. The trick, though, is not to try to cram all your studying into one big block in a week. I tell people, if you're studying an hour a day, be honest with yourself. You need to be studying and not checking your email every 5 minutes, but an hour a day, 20 minutes, review your things, set things aside, go back. What did I forget? What do I need to reinforce? What do I need to write down? What do I need to make a flashcard of? Looking at things multiple times is going to help you remember. Few of us remember everything the first time we saw it. So the studies actually show between 7 and 9 times you have to look at something before you can remember it. So that's, factor that into your study time. Look at your clinical setting as studying. Okay, I hardly ever do eyes because the orthodox love me. So I'm going to ask to be put in the eye room for a week. By the end of that time, I'm going to know the drugs. I'm going to know the types of procedures. I'm going to know the pathophysiology behind the conditions. I'm going to know a whole lot more about the kinds of drugs that geriatric patients take. So you're being paid to study. So use your clinical as part of your studying, and then subtract that from the amount of time you're sitting at home studying. A lot of people use their flashcards as their primary means of studying. Flashcards are actually meant to evaluate what you know, not to provide you with knowledge that you are learning for the first time. So if you didn't know the answer, Okay, you got the question, you memorized the correct answer, and it was on potassium. And you get to the exam, and the question is about calcium or magnesium or sodium. And you go, dang, I knew everything there was to know about potassium. Okay, this is sort of a wake-up call for you early to realize that you need to know a little bit about all the electrolytes, all the positions, a multitude of different specialties, rather than one specific answer to a specific practice question. Let's look at how to answer multiple choice questions. There are a couple of parts of a question. One is the stem. Now, the stem is going to provide all the information that you need to answer the question. Please do not add information to the stem. If you don't need to know the patient's age or their weight or even the procedure they're having, it's not going to be there. Don't add it. The question may either be open-ended or closed-ended, which means it ends with a question mark. So you'll see both of those types of multiple choice questions. There are 4 options. There's only one correct answer. And we'll do some practice questions and do a little bit more analysis here in a couple minutes. But please realize that you may not like any of the answers, and none of those answers may align with what you personally do in your setting, but there is one best answer. And that's the one that solves the problem in the stem. The other 3 options are distractors. They may be possible, but they're not correct. If it's asking you for the bone that's corrected for a bunionectomy, all 4 options may be bones in the foot, but there's only one correct answer based on what is asking you in the stem. There are no true faults, no multiple choice, no all of the above, none of the above. A, B, and D are correct. No calculations that require a calculator. There are no anatomical drawings. There are no EKG rhythm strips that you have to diagnose. I don't know if I'm making you feel better or not, but it's all words. So if reading is not your favorite thing to do, recognize that that is what is going to be required for you on the exam. Pay attention to words that help you focus. What would you do first? What's the most likely cause for this condition? What's the best answer? So if you get to all the options and you're struggling a little bit, go back and see if you missed one of those keywords. Here are some common test taking errors, and some of them are linked to experience level. Some of my more experienced people like to add things to the stem, or they overthink. The exam is based on what someone, again, with 2 years of experience should be able to know and do to safely care for a patient in the perioperative setting. If you are very experienced, you tend to be able to get to an answer more quickly than the rest of us, but you may have skipped a step or 2 along the way. Your folks who are competent, those 2-year nurses, and I'm sure you've worked with them at some point in your career, tend to still think in a very linear manner. They don't skip steps. They go in order. They're the ones who the policies and procedures are written for. Taking too much time. If you can answer a question a minute, you will get through the test in time to go back and check your answers. If you are truly stuck, give it your best shot, move on. Anything that you leave blank is going to be counted against you. So please, please, please make sure that you give yourself time to answer all the questions. Missing those words, the first, best, most. Changing a lot of answers. And this is something that you can use if you're using practice questions. If you're going through and waffling between options or changing your answers multiple times, I never say to never change an answer, but if you're truly not sure, that's a knowledge deficit. And now's the time to address that. and expecting the same questions. We talked about this already. You won't see the same questions on the exam as you see in any of your practice materials. Answering questions based on past experience. So this is only if your current practice is not based on evidence-based practice. Let's use an example. When I first started in perioperative nursing, we brought our patients in the night before. We did our pre-op teaching, we did our lab work, we shaved them the night before. Okay, that was the standard at that time. If I answered the question today about skin prep and marked shave them the night before, I'm going to miss it because that's no longer considered a best practice. So we all tend to rely, especially when we're nervous, on things that we learned initially. Make sure that you are answering your questions based on current best practice. This is my favorite one. I saved my favorite one for last. Using tricks, and I still hear this. If I'm not sure, I choose option B, or I choose the longest answer, or I choose the shortest answer, or I choose the answer that has words repeated from the stem. Let me assure you that when Prometric sits down with our item writers, they are very carefully coached on how to write a correct multiple choice question, and they avoid all of these things that might be used as tricks to get to an answer without actually knowing it. You are holding people's lives in your hands. This is not a game. We're not trying to make this into some type of contest where you can get to an answer without actually knowing it. So please understand there are no tricks to answer a question correctly for the CNOR exam. Now, we are going to do some practice questions. And what I'd like you to do is in your chat box, I'd like you to mark what you believe the correct answer is. And this helps you kind of get used to looking at how to analyze a question. Hopefully I can give you a couple tips and help you give you some confidence on how to answer these questions. Some of us have not taken a test for a while, and I know that can be anxiety provoking. So here's our first question. Is the patient population which accounts for the greatest number of eye muscle procedures? And you got 4 age-specific groups. I'd like you to write down which one you think is correct while I give you something else to think about. What do you need to know to answer this question? If you aren't familiar with eyes, where would you go? Why were the other options incorrect? And this is probably one of the biggest tips I can give you is if you're presented with a question and it's like, you know what? I flat out don't know, but I can walk through and I can identify the 3 that I know are incorrect. There's only one option left, and whether I realize it or not, whether I like it or not, that's the one I'm going to put down as correct. So let me give you a little bit more time. And let's see what people are writing. Okay, I've got people. Thank you for participating. See if there's anything else. Okay, we've got a little smorgasbord going here. We've got adolescent, adult, and geriatric. Okay, thank you. For those of you who took a chance and shared your answer with us, thank you. Thank you very much. Okay, so you kind of got these questions in the back of your brain. Here's the correct answer. Okay, you're thinking, how can that be? I read eye procedure, I thought cataract, and I marked geriatric. This is one area where your brain is not your friend because it's thinking faster than it should be. The question is greatest number of eye muscle procedures. Think strabismus and think about those little munchkins between the ages of 6 months and 6 years, because nobody wants them growing up thinking the world looks this way. So these are usually done pretty early in life. Yeah. Okay. There is our reference. I just updated it. There's our 2021 edition, page 143. So if you were not sure, if you don't do eyes or you don't do peds, you know what? None of us, very few of us do everything. So this is, you're going to find that this is your case, that you don't do a procedure or you don't do an age group. Those are the areas then that you want to be spending a little bit of extra time on. So in this case, you may want to look at spending a little bit more time with pediatric surgeries and eye surgeries in general, and certainly not expect that there's going to be a question about strabismus repair on the CNOR exam. So that's a way to use this information moving forward. So thank you. Okay. Let's go to the next question. Most effective way to evaluate a patient's comprehension of her upcoming surgery is to. Now we're looking at the most effective way. We've got 4 options, and you may utilize all of these. You may have the patient describe the procedure in her own words. You may witness her signing her consent form. You may ask yes/no questions, and you may document that the patient's received some patient education materials. But what's the most effective way? It is asking you to prioritize. And I've got people voting here. Thank you. Give you a couple more seconds. Okay. People are consistently choosing A. So let's see. How did you choose which answer you thought was correct? And some of you may be using your personal experience. Some of you may be looking at best practices for patient education in your literature or in your facility. Looking at why were the other options incorrect? Okay, and you're absolutely right. The most effective way to know that someone understands something, and you do this with your teenagers, right? You have them repeat back, what time did I tell you to be home tonight? And they say 11 o'clock, okay? Best way to understand somebody's comprehension, ask them to describe it in their own words. And there's our reference from Berry and Cohn. And we always provide not only the reference, but the rationale for our practice questions. Okay, good job, guys. Yeah, yes, no is a closed-ended question. Absolutely. And this, I love this. Thank you so much. What you're doing is providing a rationale for why you did not choose that answer, which is excellent. Yeah, thank you. That's a good practice to get into. Okay, we've got an incorrect sponge count. What are we going to do first? And we've got 4 options. Repeat the count, notify the surgeon, document the count is incorrect, or notify the supervisor. Now, we may be doing all of these things at some point in this scenario, but what are we going to do first? We've got just a plethora of people voting now. Okay, and I've got people who are choosing A, and I have people who are choosing B. Now let's look at analyzing this question a little bit before we go to the answer. So again, all of these options could have been correct. How did you choose your answer? Why were the other options incorrect? And here's our correct answer. Notify the surgeon. And some of you are providing the rationale for your correct answer, which is excellent. Excellent. That it's just like having a patient read back or teach back. I understand that you know why you chose this answer, so please continue that strategy. When we look at choosing the answer, we want our answer to fix the problem in the stem. Repeating the count is a very natural response to an incorrect count, right? I missed something. Something got kicked under the bed. Something got thrown in the trash. There's 2 Raytex stuck together in the pocket in the count bag. There's a billion different ways to lose a sponge. But while I'm looking, and some of you already provided this information, while I'm looking, what is the surgeon continuing to do? Is that going to correct the incorrect count? No, because the surgeon is continuing to close. And joint commissions changed. It used to be if the patient hadn't left the OR yet, it was not considered a sentinel event. And now they're saying if the incision is closed, it's a sentinel event. It needs to be reported. So the whole trick is to let the surgeon know, please re-explore the wound. You've got an incorrect count. I'm going to be looking every place else. And hopefully between the field and you can find that sponge. But that's the premise behind that answer, the rationale, and the reference is in AORN. They have a whole chapter on prevention of retained surgical items. So excellent. I liked how you were thinking things through. Yeah, great job. Those are all the questions I have. I'm sorry. I know we were just starting to have fun, but this just gives you an idea of how to work something through and hopefully get at the right answer. Now let's apply. You guys are all experts now. Let's pull the trigger on this thing. This, if you go to our website and go to the CNOR tab, it's going to look like this and basically walks you through step by step. So you're going to push that blue button, start my application, when you're ready to apply. Please understand, and there's extra information behind each of those letters. When you apply for the exam, if I applied in September, my testing window is October, November, December. So the month that you apply, when your application's approved, then you have that next 3 months as your testing window. Please look at your life. Are you getting married? Is it the holidays? Is it your folks' 50th wedding anniversary? Do you have some big event besides COVID that could prevent you from studying? So be honest with yourself and factor in some of those things as part of your study plan. There's some information that you need to provide for us, and few of us remember our nursing license number or our supervisor's email possibly. So make sure that you have this information, and truly 10 minutes it takes you to fill this out. But if you have it with you, then you don't have to leave the website and come back in. And some of this is for demographics. We like to look at, you know, who's taking the exam, what age group they're in, where do they work. But we also use this information in case you are audited. And please don't think that if you are audited that you have done something wrong. That is not true. We are required by our accrediting bodies to audit a certain percentage of all the applications to maintain the integrity of our process. They need to make sure that we are fairly providing information to all of you and that the right people who are eligible are taking the exam. So your supervisor might get a call. Doesn't mean you do anything wrong. We're just checking to make sure that you've met that 2 years, 2,400 hours minimum requirement. Your license is public knowledge on nurses, so that may be reviewed. And we may be asking for additional history of your nursing practice. So those are just things they're looked at in the audit. It's your responsibility to provide that information if you are audited, and you'll be given, step-by-step instructions on what you need to do to meet the requirements for the audit. But again, if you haven't done anything wrong, it's just to make sure that the people who are eligible are actually the ones taking the exam. The fee for this year is $395. Please check our website, especially if you're not going to test for 5 or 6 months. Things may change, including how much things cost. So just before you apply, make sure that this information is still the same. We talked about you apply and pay 1 month, and then you'll have a 3-month testing window. You'll receive in your email, and please check. Sometimes it ends up in your junk or spam folder or in your other folder. So once you've done this, pay attention to all your different files, because this sometimes ends up in someplace besides your main email. You'll get a notification to test, and you will take that information then and go to the Prometric testing site and use that to schedule your exam. You do not schedule your exam through CCI. You'll go to Prometric to do that. Okay, everybody knows that things have changed with our pandemic, and testing is one of them. The testing center that is closest to you may have different hours than they used to. They may have fewer seats because they have to spread people out. So there's a lot of things that can have changed in terms of actual testing. So there's another option now. You may take a remote secure proctored exam from your home, and you will find that information in the same place as if you scheduled your exam at a testing center. You will need to make sure that your computer has the bandwidth and that you have a place where you can be assured, and that Prometric can be assured, that you are in a secure place, and they will be monitoring you while you test. And there's all kinds of different additional regulations in terms of keeping the exam secure if you test from home. But that is an option. So if you're in a remote area or you just don't feel like driving to a testing center, that is another option. But please don't think that it's easier to take the test that way. You cut back on the commute, but then the onus becomes you're providing a safe, secure testing area for your exam experience. Okay, so what do we do? You're going to make sure that you have met your eligibility requirements. You're going to, if you haven't already, create a CCI account, and this means an email that you use frequently and a password. I recommend that you don't use your work email. A lot of times there's a filter or a firewall that blocks messages from CCI to that work email. So I would recommend using a personal email. And then, especially if you're using your remote proctoring, check your computer compatibility and download software to make sure it's going to meet the requirements, and then schedule your remote exam. So here's the example on our website, or I'm sorry, on Prometric's website, where it will you can either schedule remote proctoring or else at a testing exam place. So you've got 2 options now. We offer an option for people who would like to take some of the anxiety out of the testing experience. And this option provides you with a chance to take 2 exams for 1 price. This is something that your facility may offer, so you might want to check with them first, or you can do this as an individual. But you pay 1 price, 1 fee, and then if you're not successful the first time, you will be able to test again at no additional charge. So there's that information on the website, or you can talk to one of our credentialing specialists if you've got questions about the Take 2 program. Certification is not forever. It lasts, in this case, for 5 years. So you will need to apply for recertification at the end of your 5-year cycle. You will no longer have the ability to recertify using only contact hours. Your manager or some of your friends who have been nurses for a long time and CNORs for a long time might talk about just doing contact hours. That option is going away as the only sole method for recertification. You may continue to use contact hours for part of your points, but it cannot be all contact hours. And CCI, just like you have to keep up with the current trends and information, we have to as well. And there was nothing that said that contact hours alone helped people improve their practice. So we said, well, what would help them improve their practice? We're looking at what they're already doing. So this is giving you credit for the things that you're doing, as well as permission to branch out a little bit, join a committee, be a committee chair, mentor someone. There's probably 25 activities right now. We're adding to them all the time. You need 300 points. You don't need something from each activity. Look at the ones that you currently do. All of them are capped with the exception of academic. And if you've gone back to school to get your MBA or your MSN or your BSN, you may use 100% of those college credits toward your recertification. So if you are going to school and have taken 6 or 7 courses in your 5-year window, you're done. You don't have to do anything else. Now, if you are audited, you need to provide the documentation and the evidence that you actually did these things. So let's say I went back to school, I've got all the points that I need for my academic courses, I'm audited. I need to provide a transcript that says, yes, I took these classes during this time. And that's true for all of the different activities, is you need to be able to provide the evidence for that. So please, 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 when you're filling this out in your account, it's very easy. You put down the date and what it was, but if it's continuing education, you need to provide the certificate for that. If it's precepting, you need to provide the initials and the times that you precepted these people. So make sure that you've got that evidence. I'm trying to gather this stuff after the fact can be really difficult. Here's our accrual period. This is another key point of information from tonight. If you pass the CNOR exam in 2020, your credential is valid until December 31st of 2025. Look at the accrual period, though. I don't want people to be surprised. You can count, if you did some continuing education through Expo this year, you can count that. That was in April, but no, it wasn't. It was in July, I guess. But anyway, before you tested, you can count everything this year, but you can only count through December 31st of 2024, and then 2025 becomes your recert year. If you recertify before July 1st of 2025, you get a discount. You get $50 off your application. And if you pass your exam in 2021, those are your numbers. Please, please, please don't wait until the last minute to get your activities around. Especially with the activities, you really need to plan a little bit and make sure that you're getting the points that you need during your accrual window. This, again, is being recorded. We're on YouTube, which always frightens me a little bit, but it's there, and it's also on our website. Here are the rest of our webinars for the rest of this year. I can't believe it's September already. I'm going to look to see if anybody has any questions, because I am pretty much done providing you guys with information. So if you've got questions, please, please, please don't hesitate to ask. I'm going to give you my email address. So again, I'm Julie. Dawn is another great resource. She's our director. And then these are the folks who will be answering the phones. That's our toll-free number. But again, I would send an email to that info@cc-institute.org before I called somebody. They're not as likely to pick up the phone as they are to answer an email right away. Give folks a chance to ask a question if they'd like to. I don't see anyone writing any questions. I'm going to let you get back to your families and your dinners and feeding the pets. Again, please let me know if you've got questions. That's the main reason why I'm here. I've enjoyed spending this time with you. Have a great evening. Stay safe. Thanks so much for your attention and good night.